So ataxia is said to be a dysfunction of the nervous system leading to coordination problems. So true ataxia is where the cerebellum is involved. So you really need to take a good history in order to differentiate true ataxia from other forms of other abnormal gaits. Okay, so you really can divide true ataxia into two types, sensory and cerebellar. So sensory is the loss of sensory input from the lower limbs, the lower extremities, and this occurs due to nerve disease. And cerebellar ataxia is literally a lesion in the cerebellum or just degeneration of the cerebellum. Okay, so some differentials for ataxia are, our first category is acute, so that's going to be drug ingestion, e.g. Ingestion of anticonvulsants. You can have post-infectious or post-infection / immune ataxia, e.g. acute cerebellar ataxia or ataxia that occurs with Guillain-Barré syndrome or Guillain-Barré syndrome. Brainstem encephalitis, trauma, hemorrhage. Then we have ataxias which are insidious / intermittent in onset. So this could be a brain tumor, a basilar migraine, and then we get onto the ones which we're going to be discussing about, which is Friedreich's ataxia and ataxia telangiectasia. That is hard to say. So just to mention, the symptoms of ataxia really are wide-ranging. So you can get anything from it's called poor coordination overall. So you can get eyesight problems coordinating your eyesight, slurred speech. You can get cardiomyopathies. You can have balance problems. The list really does go on. Okay, so with Friedreich's ataxia, it's an autosomal recessive disorder. So you can see the pattern of inheritance there. And it's due to a repeat in the FXN gene, which leads to a lack of expression of the frataxin protein. Now, the role of this protein is still under debate. However, in Friedreich's ataxia, you get worsening ataxia, you get dysarthria, you get distal wasting of the lower limbs, your reflexes are absent, you get pes cavus, and as the posterior column is affected, you get impaired joint position, impaired vibration sense, and due to the pyramidal involvement, you get extensor plantars and optic atrophy. So later on, you can get kyphoscoliosis, diabetes, and cardiomyopathies. And all of these together can just lead to cardiorespiratory compromise, leading to death in their 40s and 50s. So ataxia telangiectasia is also autosomal recessive. Pretend that this says ataxia telangiectasia. Should have written it down, to be honest. And yeah, it's an autosomal recessive disorder of DNA repair. So there's a mutation in the protein kinase gene. And protein kinase is important in helping in the repair of double-stranded DNA breaks. So what you get in these children, you get a mild motor delay in infancy. You have ocular motor problems, a delay in ocular pursuits, balance problems at school. Later on, you will get nystagmus, dystonia, spasms, tremors, jerks, cerebral ataxia, dysarthria. So many of these children end up in a wheelchair in their early adolescence. So now let's deal with the name. So with this condition, you do get telangiectasia in the conjunctiva, and you may also get telangiectasia in the neck and shoulders. So complications of this condition equal to increased susceptibility to infection and malignancy, and development of pulmonary fibrosis. So sadly, their life expectancy is in their 20s, and this is due to death from malignancy or chronic lung disease.